Hello and welcome to the Jewish Rehabilitation Hospital's video presentation on medication that is used to prevent stroke and those used after stroke. The drugs used for treating stroke typically work in different ways. There are several kinds of medications that doctors may prescribe to a stroke patient. There are four main categories: TPA, which is used for dissolving blood clots; anticoagulants and/or antiplatelet drugs, which are used to prevent blood clots from forming; antihypertensives that help lower high blood pressure; and hypolipidemic agents are used for balancing good and bad cholesterol. The medication that your doctor prescribes will depend on the kind of stroke you had and its causes. It will depend on your existing risk factors, which is why they put you through a whole bunch of tests, like blood tests, ultrasounds, Dopplers, Holter monitor, EKG, and scans. Your past medical history plays a role as well, and of course any allergies you might have will influence which drugs are prescribed to you. The goal will be to help control your risk factors. Thrombotic drugs such as TPA are often called Clot Busters. TPA is short for tissue plasminogen activator and can only be given to patients who are having a stroke caused by a blood clot. It can stop a stroke by breaking up the blood clot. It must be given as soon as possible and within 4 hours after stroke symptoms start. It is used as a common emergency treatment during a stroke. For this treatment, TPA is injected into a vein so it can get to the blood clot quickly. Receiving TPA can reduce the severity of a stroke and reverse some of the effects, helping you recover more quickly. In some cases, TPA cannot be used and other treatments are required. It isn't used for everyone. People at high risk of bleeding into their brain aren't given TPA. It will be up to the emergency doctors to determine when TPA may be administered and if it is appropriate. It works in about 30 to 40% of all stroke cases. Antiplatelets can be used to prevent blood clots. They work by making it more difficult for the platelets in your blood to stick together, which is the first step in the formation of blood clots. They're sometimes prescribed to people who've had ischemic strokes or heart attacks, and your doctor will probably have you take them on a regular basis for a long period of time as a means of preventing another stroke. The most common used antiplatelet drug is ASA or aspirin. ASA can bother the stomach and should be taken with food. Other antiplatelets can be taken with or without food, and those include Plavix, Agranox, or Ticlet. Anticoagulants are drugs that help keep your blood from clotting easily. They do this by interfering with the blood clotting process. Anticoagulants are used for preventing stroke and mild strokes, known as TIAs. They are usually prescribed for people with an irregular heartbeat or atrial fibrillation, which can cause blood clots to travel from the heart to the brain. Anticoagulants like Coumadin and Syntron come in a tablet form. It must be taken for several days before it takes effect. It requires regular blood tests to ensure efficacy. This will make sure that your blood isn't too thin, which can cause bleeding, or too thick, which can lead to blood clots. The dosage has to be adjusted according to the international normalized ratio called INR, which usually lies between 2 and 3. The test measures how much time it takes for a patient's blood to clot, and this ensures that you are receiving the right dose of Coumadin for you. It's important to take them at the same time each day, preferably at dinner or bedtime. If you eat Leafy greens like kale, collard or beet greens, spinach, and Brussels sprouts. It's important to eat regular amounts of these greens weekly. And do not take your medication with grapefruit juice, as this interferes with its absorption and its effectiveness. There exists a self-monitoring machine for INRs called Coagucheck XS. This is a handheld device that can be available at a cost or at your local pharmacy. Many pharmacists will test your INR result, and this is a much more convenient way to monitoring your INR versus having a blood test done. It works much like the diabetic glucose machines. If you want more information, you can visit www.coagucheck.ca for more information. Because blood thinners delay clotting, their biggest side effect is unwanted bleeding. What is considered minor or major bleeding? Be on the lookout for minor bleeding. These are what is considered as minor bleeding: gum bleeding during toothbrushing, occasional nose bleeding, bruising, bleeding for a couple of minutes after a minor cut, or menstrual bleeding more abundant than usual. These are all symptoms of serious bleeding. Red, coffee-like color to your urine, red or tar-like color to your stool, gum or nose bleeding that does not stop quickly, reddish vomit or sputum, sudden and inexplainable apparition of multiple bruises, cuts that keep on bleeding after 10 minutes, menstruations or vaginal bleeding that are far more abundant than usual. In any of these cases, you must call your doctor or Info Santé at 811. In case of a nosebleed, pinch the nostrils for about 10 to 15 minutes to help stop the bleeding. But if bleeding continues, please seek medical attention. It is recommended that you buy a medical emergency bracelet or chain if you take anticoagulants and or antiplatelet medication. Also, for diabetes, specific allergies, or any other serious medical conditions like epilepsy. Known as antihypertensives, these medications treat high blood pressure. There are many different kinds of blood pressure medications. Your doctor will work with you to find the right medication or combination of medications that is best for you. Some antihypertensives include diuretics. These are also called water pills. Some examples are Lasix, hydrochlorothiazide, or Lozide. And these drugs help treat high blood pressure and heart failure, and they do it by helping your kidneys produce more urine. The more you pee, the more excess salt and water you flush out of your body. Without the extra fluid, it's easier for your heart to pump. Take it at least 6 hours before bedtime to help avoid getting up at night. Another type of blood pressure medication are Betta Blockers. These can include Tenormin, Monocar, Coreg, Lopressor, etc. Beta blockers help your heart work less. This lowers your heart rate and blood pressure. If your heart is weakened, certain beta blockers can protect your heart and help it get stronger. They protect the heart from stress and abnormal heartbeats. ACE inhibitors like Vasotec, Monopril, Coversil, Altase. These open up the blood vessels and make it easier for your heart to do its job. It makes it easier for your heart to pump and then lowers blood pressure. It protects your heart and blood vessels. It protects the kidneys in people with kidney disease or diabetes. They are usually taken for life if you have coronary artery disease. When you start an ACE inhibitor, you will need blood tests to monitor your kidney function and potassium levels because they can increase the amount of potassium in your body. So avoid salt substitutes or potassium supplements unless they are prescribed to you. ARBs, or short for angiotensin II receptor blockers, are mainly used to treat high blood pressure and heart failure. They work as well as ACE inhibitors for treating high blood pressure, but they may be a better choice if you have any side effects to ACE inhibitors. ARBs block the action of an enzyme called angiotensin II, which causes your blood vessels to narrow, and when you take an ARB, your blood vessels become relaxed, which lowers your blood pressure. It may increase your potassium levels, so you should not take potassium supplements unless your doctor tells you to do so. Calcium channel blockers like Norvasc, Cardiazem, Adalat, Verapamil are vasodilators. This means they widen and relax your blood vessels. This can help lower your blood pressure, slow your heartbeat, control irregular heartbeat, reduce chest pain. Calcium channel blockers are often taken with other medications such as beta blockers or a diuretic. Avoid grapefruit and grapefruit juice because it can boost the effect of the calcium channel blockers, and this could make your blood pressure way too low. If your blood pressure has been normal for a month, do you stop taking your medication? No. It is very important to take your blood pressure medication regularly, as prescribed by your doctor. Always talk to your doctor or pharmacist to get specific information about how and when to take your medication. With high blood pressure, how you feel is not always a good indicator of whether or not you need your medication. Do not stop taking your medication when your blood pressure becomes normal. You need to keep taking it to control it. A normal blood pressure for adults less than 80 years old is 140/90 or less. If you are diabetic, it is important to maintain a blood pressure of 130/80 or less. In this picture, you will see which blood pressure reading is normal and which one is not. In picture A, the blood pressure reads 135/95. 95 is too high for a diastolic blood pressure. Picture B is the normal reading of a blood pressure, 125/76. High blood pressure is a chronic medical condition that has to be monitored and controlled throughout your life. It is safe to say that your medication will probably be needed for the rest of your life. Is there anything that you can do to control your blood pressure? Absolutely. Reducing the amount of salt you eat is one way of helping you control your blood pressure. High sources of salt are found in highly processed foods. This includes fast foods, prepared meals, processed meals such as hot dogs and lunch meats, canned and dried soups, bottled dressings, packaged sauces, condiments, and salty snacks. Also try to reduce your use of salt in cooking and at the table. The Heart and Stroke Foundation recommends that Canadians eat less than 2,300 milligrams of sodium, which is about 1 teaspoon of salt a day, total from processed foods and salt added during food preparation and at the table. So if you have high blood pressure, the recommendation is to eat less than 2,000 milligrams of salt a day. Achieve and maintain a healthy body weight. If you are overweight, losing even 5% or 10% of your weight can help reduce your blood pressure as well as decrease your chances of having a stroke. If you drink alcohol, limit yourself to no more than 2 drinks a day to a weekly maximum of 10 for women and 3 drinks a day to a weekly maximum of 15 for men. Other ways of helping control your blood pressure is to be physically active for at least 150 minutes per week, doing moderate to vigorous physical activity in bouts of 10 minutes or more. Find healthy ways to manage your stress. Too much stress may increase your blood pressure. Research suggests that the way in which you manage your stress is very important. Avoid unhealthy coping mechanisms such as smoking, alcohol use, poor food choices, not being active, watching too much television. Find relief instead with physical activity, socializing, laughter, healthy eating. Remember to take time out for yourself. Get tips on relaxation and mindfulness from people who are living with heart disease and stroke. Be smoke-free. If you smoke, speak to your doctor or nurse about quitting. If you don't smoke, minimize your exposure to secondhand smoke. Check your blood pressure regularly at home. Home monitoring can help your doctor to diagnose your blood pressure correctly. If you have one high reading, you should check it at least 2 more times on separate days to determine if it is consistently high. Keep a record of your blood pressure readings, write them down. This record will help determine whether your blood pressure is well controlled. High cholesterol is another risk factor for stroke. If you do have high cholesterol, your doctor will certainly put you on a cholesterol-reducing medication. The only way to know if you have high cholesterol is to have a simple blood test. It is important to keep your total cholesterol less than 5.2. It is important to have your HDL cholesterol, which is your good cholesterol, at a high number above 1. LDL cholesterol, which is your bad cholesterol, is important to keep low, less than 3.4. But if you are diabetic, it's better to have it at less than 2. Your triglycerides should be less than 1.7, and high readings may be tracked over time. Sometimes diet and exercise are just not enough to help lower your blood cholesterol levels. Several medications are available to lower your blood cholesterol. Your doctor may prescribe medications that include statins and other cholesterol-lowering medications. These medications do not cure high blood cholesterol or replace a healthy lifestyle. Statins help lower cholesterol levels. When your cholesterol levels are too high, cholesterol can start to build up along the walls of your arteries, and this buildup is called plaque. These drugs block an enzyme that your body needs to make cholesterol, so your body makes less of it, and this helps to reduce the risk of plaque and prevent strokes or heart attacks caused by clogged arteries. Some examples of statins are Lipitor, Provocol, Crestor, Zocor, and many others. High cholesterol is not the only factor in plaque formation. Plaque can still form with lower cholesterol levels. If your arteries are blocked with plaque, you will probably take a statin even if your cholesterol is low to normal. Be aware that the anti-plaque effect goes away if you start taking your statins. So statins are usually taken for life, even if your cholesterol levels return to normal limits. Take them once a day, usually at night. If you take Lipitor or Crestor, those can be taken in the morning if it is easier for you. Avoid grapefruit or grapefruit juice if you are taking Lipitor, Zocor, or Mevacor. Some people may experience upset stomach, constipation, gas, sore muscles, cramping, or weakness that doesn't go away. Lowering the dose or switching to a different statin may help, but speak to your doctor if you are having any problems. Diabetes increases the risk of high blood pressure, arteriosclerosis, which is the narrowing of the arteries, coronary artery disease, and stroke. If you are a person with diabetes, you have a higher risk of developing stroke. People with diabetes are 3 times more likely to die from heart disease. Controlling your blood sugar level is crucial to your health. Healthy lifestyle choices can help bring your blood sugar level back to normal and keep it from rising. The good news is that lifestyle changes you need to make are the same choices that will help you to lower your risk of stroke. Follow these basic steps to protect your health. Aim for blood sugar between 4 and 7 on an empty stomach. Your HbA1c levels should be less than 7%. Take your medication and insulin as prescribed. Take advantage of the Cible Santé educational workshops on diabetes that is offered here in Laval. Speak to your nurse for more details. Needles are intended for single use only, but it is known that a significant amount of people with diabetes do reuse their needles. Reusing your needles could increase the following: bacterial growth on the needle, likelihood of experiencing pain when injecting, risk of lipo hypertrophy, which is a lumpy skin occurring where you inject, risk of the very fine tip of the needle breaking off. And these risks will grow and increase with each reuse. Needle manufacturers note that the safety checks that needles need to pass are based on single use only, so always throw your needles away after each use in a safe fashion. Lipo hypertrophy or lipodystrophy is when fatty lumps appear on the surface of the skin and is a fair common side effect of insulin injections. This will usually occur if multiple injections are administered to roughly the same part of the skin over a period of time. When the skin becomes lumpy, it may mean that if the insulin is injected into the lumpy area, it won't be absorbed consistently, which can mean that the insulin takes longer to be absorbed, leading to higher than normal blood glucose levels, or it can get absorbed too quickly, leading to hypoglycemia. To prevent this, rotate your injection site. Ideally, you should aim to keep each new injection spot at least an inch away from your previous injection sites. If you are a diabetic who is on insulin and needs to monitor your blood sugar levels 4 times a day, there is a device called Freestyle, which is a glucose monitoring system, which is small and convenient. It's a sensor embedded into your skin, and it reads your blood sugar levels when you scan the device. With every scan, you can get your current glucose reading, the last 8 hours of glucose data, and an arrow showing the direction of where your sugar is heading. Quebec is providing reimbursement for this device if you are managing diabetes with insulin. It requires no finger pricks to monitor your sugars, and the device can stay on for up to 14 days. Smoking contributes to the buildup of plaque in your arteries, increases the risk of blood clots, reduces the oxygen in your blood, and makes your heart work harder. In fact, smokers are 2 times more likely to have a stroke and 2 times more likely to die from them. People who smoke 25 cigarettes a day or more have 3 times the risk for heart attack or stroke and are nearly 5 times more likely to die. As soon as you quit, your body starts to recover. Within 24 hours, your chances of having a heart attack start to go down. Within 5 years, your risk of having a stroke will be nearly that of a non-smoker. Within 10 years, your risk of dying from lung cancer is cut in half. And within 15 years, your risk of heart disease will be similar to someone who has never smoked at all. Other benefits include you will save money on cigarettes, your life and house insurance premiums may go down, smoking will no longer control your life, you won't have to search for places that let you smoke, you'll feel proud of your ability to overcome something so challenging, and your sense of smell and taste will begin to improve. To successfully quit smoking, you need to address the physical addiction and the psychological habits that go along with it. This is hard, but you can do it. Ask for help. Tell family, friends, and co-workers that you plan to quit. Let them know your plan and how they can help. Talk to your doctor, your nurse. There are many medically approved smoking cessation aids to help you overcome withdrawal symptoms and increase your chances of success. Since 2018, many cannabis products have been legalized for recreational use. The emerging evidence shows an increased risk for heart disease and stroke from the effect of cannabis on blood pressure, inflammation of blood vessels, and cardiac arrhythmias. These drugs increase the risk of strokes by 6 times. There are times in a woman's life when she is at an increased risk of stroke: during pregnancy, menopause, and her older years. Oral contraception and hormone replacement therapy both increase the risk of stroke. Discuss this with your doctor, what this means for you, and what your options are. It is important to follow the recommendations of your doctor, nurse, and pharmacist. Poor adherence, such as not taking your medication, increasing or decreasing the dose of your medication without consulting your doctor first, not taking your medications at the right time, using the remains of an old prescription, combining your medication and supplements without the agreement of your doctor or pharmacist or nurse. This all results to poor health. Poor adherence can lead to treatment failure, unnecessary additions or changes to your medication regime, evitable hospitalization, toxicity levels, or a new stroke. Research has shown that 12% of people stop taking their medication after 1 month and 40% after 1 year. Some tips for you that can be helpful. Know the names, doses, and modes of action of your medication. Keep an up-to-date list of all your medication at hand. Bring your list of medication with you every time you consult a health professional. Store your medication appropriately in a cool and dry place. Avoid the bathroom. Keep them safe from children and animals. And take necessary precautions when traveling, especially with Coumadin. And keep your medication in your personal bag, not in your luggage, in case your luggage gets lost. Other practical tips: make an appointment with your family doctor when you get back home from the hospital or before the expiration of your prescription. If you don't have a doctor, you will have to renew your prescription at a walk-in clinic. The pharmacist may extend your prescription so that it is not interrupted. Consult him first. Taking medication around meal times, using visual cues and reminders, or using a cell phone app are practical tips to help remember to take your medication. If you take more than one medication, a dosette can be prepared for you by a family member, or ask your pharmacist about the Dispill system. If you are experiencing side effects from a medication, never stop taking your medication before asking your doctor or pharmacist. The doctor may help control your side effects simply by changing the dose or the time at which you take your medication, or he might change the drug completely. Many people think there is no risk in mixing natural products with their medications. This is not so. Always ask for the advice of your pharmacist. Before surgery, even a dental surgery, let your doctor or dentist know about the medications that you are on. When stopping an anticoagulant or antiplatelet drug, substitution medications can sometimes be prescribed. You forgot a dose? What should you do? What if you forget to take a dose? Don't double the dose the next time. Take the forgotten dose as soon as possible, unless it's almost time for the next one. In that case, drop the missed dose and continue with your normal schedule. When in doubt, call your pharmacist. Exercise is an additional prescription for your health. Exercise prevents and even treats many health problems. It helps control your blood sugar levels and your blood pressure. It helps with weight loss. It improves stress management and helps keep your heart healthy. Make physical exercise part of your healthy habits, 30 minutes a day or 150 minutes a week.